use that gray slider bar in the middle of the screen to customize that view so that you can capture whatever it is that you're looking to capture here. As far as the slides and the presenters go, that gray slider bar can be moved right and left. So we'll go ahead and get things started today. We've got Dr. Rachel Herlihy, our state epidemiologist, CDPHE, and Director Scott Bookman, COVID-19 incident commander at CDPHE. I'll go ahead and throw it over to Dr. Herlihy to get things started.
Great, thank you so much. Good afternoon, and thank you for being here. So I want to start here where we normally do with our case trends and comparing what we're seeing here in Colorado, which is shown in green, compared to the US overall. So this figure is showing you our 7-day case rates. And what you'll see in this figure, if you look to the far right, is that the US overall has seen a steady decline in cases. About a week ago, when I shared this data with you, we were seeing a clear declining trend in cases here in Colorado. But in the last week or so, that trend has reversed a little bit. We're not seeing a clear increase, but it does look like more of a plateau than we were hoping to be seeing at this point. So again, clear declining trend in the US overall, but more of a plateau here in Colorado. And with that, you'll see that our rates here in Colorado are now quite similar to what the overall rates are in the US. For the last several weeks, really months, the Colorado rates have been lower than US rates overall. But at this point, we're looking pretty similar to the US rates. Again, because most areas of the US are seeing rates declining faster than what we're seeing here in Colorado. Next slide, please. And as always, or at least as what we've been observing in the last few months, there's quite a bit of variability based on age group and also based on geography. So this particular figure is showing you the 7-day case rates by age group. You'll see that adults are shown in that teal color, that 18+ population. You'll see there we're actually still seeing a slight decline in cases overall. But in those younger age groups, the 6 to 11 year age group, which has the highest rates right now, and then followed by the 12 to 17-year-olds and the 0 to 5-year-olds, that's really where we've seen that rebound in cases. So we were seeing a nice steady decline for a little while. And then unfortunately, in the last week or so, we've seen a bit of an increase in those age groups. So again, overall, declining rates among our adult population, but the opposite trend, increasing rates in our pediatric age groups right now. Next slide. And one of the other indicators that we often look to is our percent positivity data. So this is the percentage of our PCR tests that are being reported to us that are positive. So this is another way for us to look at overall trends in the state. You may recall that since the beginning of our pandemic, our goal has been to have that number less than 5% as an indicator that we have sufficient testing occurring in the state to identify cases occurring and control the pandemic. You'll see that for the last few months, we have been above 5%. Much of the country has been as well. But we also look at the trajectory of this percent positivity line, and it can often be a leading indicator for us, showing us perhaps earlier than our case data and certainly earlier than our hospitalization data, where our trends might be headed. And so it is concerning to me that we have seen a rise in this percent positivity value in the last week or so. So we're going to be watching this data carefully along with our case data and of course our hospitalization data to see where trends head in the next couple of weeks. As I mentioned last week and have been saying for the last couple of weeks, we know that fall is a transition time and it's really difficult to predict what's going to happen as more individuals move indoors and our behaviors change as the fall season goes on and moves into winter. Next slide, please. So just as we're seeing variability by age group, we're also seeing quite a bit of variability across the state right now. Most of the Front Range, we are seeing steady or declining rates in cases, but different areas of the state are some of the regions where we're seeing increasing trends right now. So some of those places where we are seeing some increasing trends include the San Luis Valley, also some of our counties on the Eastern Plains, and then also the southwest part of the state is an area where we are seeing some increasing rates right now. So a lot of variability across the state right now and what we're seeing. And even within this variability by region, we also see variability in each of these counties and whether cases are occurring predominantly among children versus adults. So lots of complexity in the data right now, lots of really epidemics within the epidemic occurring here in Colorado. And with that, I'll hand it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you to everyone for joining today. Similar to what Rachel has been talking about earlier here, is we are starting to see our hospitalizations trend back up in the wrong direction. Over the previous few weeks, we had been seeing a relatively steady movement down, even if day to day there was some variability. But we are now seeing an upward trend. It does still show some variability each day, but we are starting to hover around the 900 patients hospitalized at any given day mark. And 2 weeks ago, we were probably down in the 875 range. So continuing to watch our hospitalization numbers very closely. Again, concern with that percent positivity as a leading indicator. Heading in the wrong direction, we will be keeping a careful eye on our hospitalizations as well. Next slide. As we have discussed many times at these press conferences, this continues to be a pandemic of the unvaccinated at this point. And vaccinated people are 8 times less likely to be hospitalized for COVID in the state of Colorado. And so I want to reiterate once again, the vaccine is free, it is widely available, it is safe, it is effective, and it is our ticket out of this pandemic. It is the ticket of keeping our health system protected for those who are suffering from other illnesses, cardiac events, traumatic events, to ensure that we have all the hospital capacity that we need as we go into the fall and into the winter. Next slide. And here is just a snapshot of comparison yesterday to today on our hospital numbers. Again, pretty significant variability. We were at 909 yesterday. We're at 890 today. You can see that ICU bed utilization kind of varying along with that. But as we have also discussed over the last several weeks, we see a lower number of ICU beds available in the state than we have at any previous point in the pandemic, based on Coloradans returning to their normal lives and the impact that these COVID hospitalizations have on top of that. And so we will continue to monitor, we will continue to work with our healthcare partners to ensure that we are level loading capacity across the state to meet the needs of all. Thank you. I think that was my last slide.
All right, thank you, Dr. Herlihy and Director Bookman. With that, we will open it up to the media Q&A portion of today's Avail. We're going to go ahead and use the raise hand function. You can find that down in the bottom of your console, and we'll go ahead and get to questions in the order that they were received. We'll start with first questions first. We'll have time to come back to follow-ups and second questions if time permits at the end, but we'll go ahead and get through everybody's first questions so we can make sure everybody gets a chance. And please state your name and the outlet you're from before you ask your question. Any questions on topics that were not covered on today's media Avail, or any questions that cannot be answered here, feel free to email us at media_info@state.co.us. We'll go ahead and start by, let's go ahead with Chris Vanderveen. Go ahead.
Hi, Chris Vanderveen with 9 News. I guess, what is the best explanation we can come up with right now as to why really we've seen that really stubbornly high caseload in the state of Colorado and the patient count really not decreasing? In fact, over the last 5 or 6 days, it's been increasing while the rest of the US isn't necessarily doing this. So what's going on in Colorado that makes us unique?
Yes, I wish I had an answer to that question. I think we certainly have some theories on why that could be, but I think it's important to remember that throughout the pandemic, we have seen quite a bit of variability from place to place. We know that it hasn't been a uniform epidemic or pandemic that's been experienced across the country or even within Colorado. We see certain counties here in Colorado have higher rates while other ones have lower rates. And in the same vein, at the national level, we've seen Colorado rates, peak earlier than national rates at times. We saw that last fall. If you recall, last year, Colorado started to see a peak in cases late fall, peaked in early December, but the US didn't peak until several weeks later. So I think there is just some seasonality at play. I think there's also just other social network issues at play here that we don't fully understand. mixing of individuals, different behaviors from region of the state to region of the state, or region of the country to region of the country. Unfortunately, we don't have a great explanation why there are these differences that we see from time to time.
All right, Vinny, go ahead.
Yeah, hello, good afternoon. It's Vinny Daljudice at Bloomberg News in Denver. What variants are currently present in Colorado? And do you have percentages of what is causing infections at this point? Thank you very much.
Yes, based on our Sentinel laboratory surveillance work, we are seeing 100% of the Delta variant or Delta variant sublineages. So the AY sublineages of Delta. So that's really absolutely the only virus that we think is circulating in Colorado at this point. Delta has demonstrated to us that it has clear advantages over other variants in being transmitted from person to person. And because of that, it's really sticking around, and we haven't seen other variants be able to get a foothold and replace it.
Thank you very much. Have a great weekend.
Tatiana, go ahead.
Hello, I'm Tatiana. I'm the new reporter for the Colorado Sun. I'm actually writing about CDPHE, your decision to bar the Dr. Moma Clinic in Colorado Springs from offering any more vaccines. And I was wondering if you could offer any more info on whether or not the leaders there will be held accountable in any other way aside from just being barred from offering the vaccine. And is that it for your investigation, or do you have other plans for other investigations into that clinic regarding this or other things?
Scott, I'll take that question. So Dr. Moma, the clinic was suspended in early April after the irregularities in their vaccine administration was identified. We conducted an investigation into this in conjunction with CDC, and they have been officially notified as of last night or this morning that they are being removed from the COVID-19 vaccine provider program. And we will not be, re-engaging with them on vaccine work. As far as other ongoing investigations, I would have to defer that to other state agencies and other federal agencies. That is outside of CDPHE's purview.
Thank you. Let's go to Seth. Go ahead.
Thanks, Seth Klayman at the Gazette. Dr. Herlihy or Scott, do you know how many of the ICU patients currently are COVID patients? Do you have any sort of breakdown?
This is Scott. I don't have that breakdown in front of me right now. I don't know if Dr. Herlihy could speak to kind of historical numbers that we've seen. In the conversations that I've had with healthcare leaders across the state, there really is a significant amount of churn right now. Patients come in, many of them are admitted for a short period of time and then discharged. And they're starting to see a larger number of just kind of long stay patients in the ICUs who are, on ventilators, and they're really, unable to get them off the ventilator and to get them discharged.
I can provide an estimate based on numbers that we've looked at recently. That number has been, and again, I don't know if this is the current number, but we last looked at that number a couple of weeks ago, and it was approximately 40% of the ICU patients that were in the ICU were due to COVID. The other were just the typical ICU patients that we see year round. So again, that 40% is on top of what we would typically see in our ICUs, and that's obviously accounting for the stress that our ICUs are feeling right now.
Thank you.
All right, Chris Vanderveen, go ahead.
Thanks. I'm wondering where we're at with RSV cases, and also with, are we starting to see any influenza cases in Colorado?
Sure, I can take that question. So we actually have seen a slight decrease in RSV cases. That's certainly good news for us. We were concerned that we were going to have a long extended RSV season with a continued increase in cases. As you probably recall, several weeks ago, we were seeing a much earlier than expected RSV season. Since that time, the numbers have come down a little bit, which is great to see. We do expect that we will probably see an increase again in RSV as we get further into respiratory virus season. Typically, we see RSV peak in Colorado in February. Like influenza last year, we really didn't see much RSV. And so the virus is behaving pretty unusually right now and causing illness at a time in the year when it normally wouldn't. So we can't predict exactly what it's going to do, but we do anticipate that we will see it again, probably starting in a couple of weeks. We might see those numbers start to go up again, and we are going to be preparing for an RSV season later in the year like we typically would. Things have been quiet so far with influenza. We have seen, nationally occasional cases occurring here and there, but haven't yet seen that increase in influenza-associated hospitalizations. But keep in mind that this is the very beginning of the influenza season. We typically say that the season kicks off at the beginning of October. Here in Colorado, we start to see an increase oftentimes in November into December, with a typical peak occurring in late December, early January. So we're going to be paying close attention to that data, obviously, over the next couple of weeks to see where our trends go, and watching our neighboring states across the country, looking for some leading information on what we might expect here in the state.
Thank you. Do we have any additional questions in the room this afternoon? All right, if you have any additional questions at any point, please feel free to reach out to us at media_info@state.co.us, and we'll get back to you as soon as we can. Thank you, Dr. Herlihy, Director Bookman, and thank you all for joining, and we hope you have a good weekend.